You do not have to pay your medical bills. As healthcare workers, especially in allied health for sterile processing technicians, we have the responsibility of decontaminating instruments from the user department, cleaning them up, and setting them up for future surgical procedures. This is where it gets complicated. There are about 310 million surgical procedures performed worldwide, and then 40 to 50 million of that is performed in the United States. When these procedures are performed, they are performed with instruments that we sterilize for the operating room or any minor procedure for that matter. But there are risk factors involved with medical instrumentation. There are surgical site infection and hospital acquired infections. Surgical site infection will fall on a hospital acquired infection, which are termed as HAI. So, hospital acquired infection is any ailment that you might have gotten when you got into the hospital for a different reason. For example, you went to the hospital for headache or ankle sprain, and then you ended up with MRSA. That's a hospital acquired infection, whereas surgical site infection is any infection that happens on the site of the surgical procedure. If a patient has an infection after a surgical procedure is done, it's called a surgical site infection. Over time, it has been reported by numerous organizations about the infection of medical devices to patients. This is just for educational purposes. We go back in time from 2015 up to now, you'll find out that some institutions have patients infected with medical devices that were not properly cleaned or sterilized. And the agency responsible for monitoring infection in hospitals and trying to track them down and actually try to control them is called the CMS, is the Center for Medicare and Medicaid. They control Medicare, Medicaid. They are under the Department of Health and Human Services. They also control or oversee the CHIP program, and they also oversee the Healthcare Insurance Portability Accountability Act, which is called HIPAA. And one knows that HIPAA is there to protect patients' rights. So in 2008, the CMS came out saying that hospitals will not be reimbursed for the treatment of patients who have had infection at their facility. They will not be treated for infection at the facilities. If it happens over and over, that hospital will have the Medicare and Medicaid patients withdrawn from them. Over time, it has become clear that hospitals now will treat patients, making sure that our medical instruments and devices are safe for patient use. Because if a patient comes out with a hospital-acquired infection, they're not allowed to pay, or they have the right to refuse to pay because of this mandate. Because there were numerous occasions where patients were getting infection from endoscopes, which is the main culprit for this. That's why if you have any hospital-acquired infection, if you went with a sore thumb and you came out there with a broken ankle or MRSA or any other microbial disease that you didn't go into the hospital for, you should not pay for that treatment. You have the right not to pay for that treatment.